Hello guys, my good name is Sarah, and in today's video I'm going to be showing you how nurses, doctors and surgeons usually scrub or rather wash their hands thoroughly and how they dress up before going to the operation room. So all this cleaning is usually done in the scrub area. And so when you get into the scrub area, you have to remove your Crocs and put on the gumboots, and then you have to put on that apron. So first of all, I'll remove my Crocs and put on these gumboots. And when you put on the gumboots, you have to find the right size of the gumboots so that you tuck in your trousers into the gumboots so that no blood will spill on your trousers, and it's supposed to spill on the gumboots and it's not supposed to touch your skin. So I tried to fit those gumboots. They didn't fit me, so I had to remove them and put on the ones that I was comfortable in. Yeah, so right there I'm putting on the other gumboots and let's see if they fit. Yeah, so I had to take the bigger ones and try them out, and luckily, yeah, it was okay for me. And as you can see, I'm tucking in the trousers. The trousers are supposed to be tucked in into the gumboots. Then you have to put on the apron. This apron is waterproof and also the gumboots are waterproof. So if you put on the apron, blood won't spill on your cloth. It will just spill on the apron, and it's waterproof, so your cloth won't be affected. So right there I'm putting on the apron. Yeah, and before you get into theater, you have to have that cape, mask and the scrubs. You can't get into theater with any other cloth. So yeah, you're supposed to tie that apron. So right there I'm tying the apron, and then next we are going to wash our hands in a very unique procedure, and this is where you have to pay attention because this is the major part of scrubbing. This is what scrubbing is all about, the procedure of washing the hands. As you can see, yeah, so before you wash your hands, yeah, there is soap there and there is a tap there, so you have to use soap. Yeah, so first of all you have to rinse your hands. If your hands are soiled, you have to rinse without soap first, but for my hands they were clean, so you have to create space because you're going to clean your hands from the palms up to the elbow. And so if you have long scrubs like mine, long sleeve, you have to bring them up. So first of all you take the soap and you rub the soap on your hands, that just as usually do when you want to wash your hands normally. You rub the soap and a lot of soap, then you rub your hands in a circular motion 5 times, then on the back of the hands 5 times and vice versa, then on the palms interlocking fingers 5 times and vice versa, then like that interlocking just as you can see. Then you wash the thumb, then you go right there up to the elbow, then you come to the other hand, the thumb, then right up to the elbow. Then that's how you rinse in that formula so that the dust doesn't go from where it came from the cleanest part. So you wash like that up to the elbow, then you rinse again like that up to the elbow, then the other hand like that up to the elbow. Yeah, and once you have done that, you're not supposed to touch anywhere, and that tap you leave it like that, and your hands will remain up forever. Your hands are not supposed to go down before your waist, under your waist. So when you go to the theater, there is that towel, there is a towel, you rub your hands like that, then you go to the other side of the towel and rub your hands like that and drop it down, and your hands should not go below your waist. Then that's the gown that you have to put on before the operation. That's how you're supposed to put on. You touch the farthest ends and you put on like that. Then you're not supposed to touch the back of it, so someone else, another nurse or another person in theater, is the one who's supposed to tie the gown at the back. So the hands, they are not supposed to come out of the sleeves. As you can see, the hands are supposed to remain into the sleeves. The hands are supposed to remain inside the sleeves, yeah, like that. Yeah, but this gown was short, so I had to do that. But your hands are supposed to remain inside the sleeves. Then there is sterile gloves. There is a formula in which you have to put on the sterile gloves. Yeah, that's how you're supposed to put on. You touch the inside part of it. Then the other glove, there is a way which you're supposed to put on. Yeah, you see, the sterile part is supposed to touch the sterile part. Then you put on the gloves. Yeah, then you adjust it. It's supposed to cover the sleeves. The sleeves are supposed to be tucked inside the sterile gloves, just as the gumboots, just as the trousers supposed to be tucked inside the gumboots. Yeah, so and we put on 2 sterile gloves. So after we put on the first sterile gloves, the second ones you can just put them on because it's sterile and you are sterile. Then if you are doing, for example, LCS, you can add the gynecology gloves. Yeah, and mostly in our theater we usually add the gyne gloves because the gowns, yeah, they might be short and you don't want to get into touch with the patient's blood. So you put in the gyne gloves, and the gyne gloves are usually longer than the sterile gloves, so they're going to tuck in the sleeves very well. Yeah, so and after that you have to, your hands have to remain above the waist like that. So you have to remain like that until when the procedure will start. You're not supposed to drop your hands. So the sterile part is the front part. You're sterile on the front part, but the hind part is not sterile. So after dressing, this is how you remain until the surgeons also dress up and start the procedure. Then after the end of the procedure, you remove the gloves. Now you can address yourself because you're not sterile anymore. So right there, after the procedure, you can undress yourself. And this gown, now it's dirty, you take it to the sleeves room. Yeah, you can now adjust your long sleeved skirts. Then the apron, you can also untie yourself and you take it to the sleeves room for it to be cleaned. Yeah, they're usually cleaned before the next patient, and the scrubs, the gown is usually sterilized after being cleaned. It's taken to the CSSD and it's sterilized, yeah, before the next patient uses it, yeah, for infection and prevention. Then you remove the gumboots. Yeah, you remove the gumboots and take it to the sleeves room and put on your Crocs. Yeah, remove the gumboots and put on my Crocs. Yeah, and return the gumboots to the sleeves room for them to be washed. And that's the end. Bye guys, make sure you subscribe. Bye.